Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headline. Revise advisory for managing healthcare workers working in COVID and non-COVID areas of the healthcare facilities. With the rising number of COVID-19 infection among healthcare workers, professionals, Union Ministry of Health and Family Welfare has recently issued a revised advisory for managing healthcare workers working in COVID and non-COVID areas of the healthcare facilities. The advisory lays down guidelines for various institutions as well as healthcare workers, particularly in the context of safety from healthcare-associated infections while managing COVID. The guideline aims to establish the preventive measures to be observed at the institution level as well as testing and isolation measures for healthcare functionaries. Regarding the institutional mechanism for preventing and responding to healthcare-associated infections among healthcare workers, the guideline states that all health facilities have to activate their Hospital Infection Control Committee. The Hospital Infection Control Committee in the health facility will be responsible for implementing the infection prevention and control activities and organizing regular trainings on IPC for healthcare workers. Further, the guideline also states that a nodal officer has to be identified by each health facility to address all matters related to healthcare-associated infections. With reference to preventing such infection among healthcare workers, the nodal officer will ensure that the appropriate use of PPEs, healthcare workers in different settings of hospitals, training on infection prevention and control among all healthcare workers, and aware them the common signs and symptoms, need for self-health monitoring and need for prompt reporting of such symptoms, making provision for regular screening of all hospital staff to make sure all healthcare workers are vaccinated with 2 doses of COVID vaccine and also take precautionary 3rd dose as per prescribed protocol. The guideline also states the action that the healthcare workers must follow while prevention of COVID-19 infections. The healthcare workers need to ensure that all preventive measures like frequent washing of hands, use of alcohol-based sanitizer, respiratory etiquettes, and these all things are followed at all the times. A buddy system to be followed to ensure that there is no breach in infection prevention control practices. Buddy system is when 2 or more person team is formed amongst the deployed hospital staff who share responsibilities for his or her partner's safety and well-being in the context of appropriately donning and doffing of PPEs, maintaining hand hygiene, and taking requisite steps on observing breach of PPEs. If any healthcare worker who is manifesting signs and symptoms suggestive of COVID-19, he or she will be tested and isolated immediately, and if tested positive, the following actions shall be taken. In case of mild case, healthcare worker will have an option of home isolation, subject to the conditions stipulated in the revised guidelines for home isolation of mild or asymptomatic COVID-19 cases. Such cases would end their home isolation as per timeline provided in the said guidelines. In cases where home isolation is not feasible, such mild cases will be admitted to a COVID care center. Moderate cases that require oxygen therapy shall be managed at a dedicated COVID-19 health center. Several cases will be managed in a dedicated COVID hospital. The advisory further adds that healthcare workers can resume duties while wearing appropriate PPEs if symptoms have resolved and they are favorable for 3 successive days. Those healthcare workers who test negative and continue to be symptomatic will be treated in non-COVID ward as per their clinical diagnosis. They can resume work based on the clinical diagnosis and the medical certification by the treating doctor. Discharge of COVID-19 positive healthcare workers will be in accordance with the discharge policy laid down by the ministry. Lastly, the guideline also adds the regular quarantine of healthcare workers after performing duty in COVID-19 areas is not warranted other than stipulated above. For more details, you can check the link below in description box. That's all for today. Thank you. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.